What is going on, everyone, and welcome to the Healthy, Fit, and Pain-Free podcast. I am your host, Doc T, and welcome to episode 58. This is titled, Is it Nerve Pain? Simple. Is it nerve pain? Yes or no? So, the reason being I want to do this podcast, actually I had a few members bring this up to me. I had a few of the coaches bring this up to me through the past couple months, and people a little bit worried that they are having nerve pain, and so I really wanted to kind of put this to rest for people so they have an idea of what exactly is nerve pain, how to tell if you're having it, little self-assessments you can do, and what you should do next. So, without further ado, why did I do this podcast? Well, again, I kind of just told you about our members and the coaches, but let's dive a little bit deeper into nerve pain, shall we? So, studies show, and this was in the International Journal of Immunopathology Pharmacology, they found that it's anywhere between 3 to 17% of the population at any given time is having nerve pain, some sort of nerve pain, whether that's from the neck or from the low back. Now, 3 to 17% is super wide. And so I'm a little bit skeptical with this, so I dove a little bit further. I found in the Journal of Psychiatry that it's estimated that only 1.5% of the population is. So to give you an idea, 1.5 to 17% is high. And why I bring this up is because it's kind of hard to differentiate nerve pain from regular pain. You can even see through studies because pain is what's called a subjective measurement. You tell us that you're having pain, you tell us what the number is, but we don't really have a test that shows that there is actually something that's contributing to that pain. Sounds weird, but keep following me here. And in reality, it's kind of a little bit lower than there. But to kind of compare this, let's say with low back pain, and low back and neck pain. So it's said that 60 to 80%, it's now more 80%. 80% of the population is going to experience low back pain at some point in their lifetime. Doesn't mean it sticks around. It just says they're going to have it. Now, with neck and back pain, 15 to 20% of people are having neck to low back pain at any given time. So you can see where that upper percentage of that 3 to 17% is, probably contributing to that 15 to 20% is probably contributing to that 17%, or around that factor. So again, kind of looking at it on the lower end of that 1.5 to even 3%. Now, to go a little bit further, let's talk about what contributes to nerve pain, because that's the big thing here. There are multiple factors, but they're extreme factors that actually contribute to nerve pain. These are things such as if you have some immunocompromise, and this is typically like some sort of immunodeficiency type of disease. There's also like metabolic disease, such as diabetes, can contribute to this. Things like alcoholism or drug use. Systemic type of illnesses, such as like shingles or anything like that. HIV, which is, again, goes back to like immunocompromised, but systemic diseases such as those. If you're going through some sort of chemotherapy, that can contribute to it. Nerve trauma, such as spinal cord injuries or amputations. So you can see how these are really extreme. These are very extreme cases. And unless you fall, now again, this is that, we're talking about that 1.5 to 3%, which can maybe go up 17%, probably not. That population are these people, all right? So, again, I'm not trying to rip the rug out from underneath you if you think you're having some sort of nerve pain, but unless you have any of these prior conditions that might leave you susceptible to having nerve pain, very unlikely you are. Now, let's dive into this a little bit further. So, nerve pain is actually that it's typically called allodynia, or means that there's not really a known cause of the actual nerve pain. And this is where you are having a hypersensitivity of the entire nerve. And this is, from your back the whole way down to your foot, This is from your neck the whole way to your fingertips. Like, you are having an uncontrolled type of nerve pain that is shooting through to where it's very hypersensitive. Things such as just you touching the skin can kind of light you off. Also it's called something different. But these are, this is what nerve pain actually looks like. Now, if you have a little bit of numbness or you have like a local type of tenderness, that's probably not nerve pain. Okay? So, how to further investigate if you're having nerve pain. So, this is things like your limb goes numb and stays numb. Now, we're talking about the whole limb. We're not talking about just a certain area. If it is a certain area, we could be talking about a nerve, but it's not necessarily nerve pain. We're talking about maybe that, and we'll go a little bit further of what is it, what could be causing it. But if you're talking about just like little areas are numb, it could just be an easy compression of the nerve. It's not actually nerve pain. It's not that there is something actually attacking the nerve that's causing this hypersensitivity. So, limb goes and stays numb. Persistent weakness. This is a big one that people miss. If you're feeling weaker in that limb and it continues to progress, that weakness progresses over time, or technically regresses, then that's another cause. That's another symptom that people experience. Atrophy. You'll see that limb actually get smaller. So you'll see this with people who, if they've had a severe, and I'm talking like severe herniation of their disc that didn't heal properly. And this is a very low percentage of the I don't have the actual number in front of me, but this is a very low percentage of the population that goes through this. I'm not talking about, most of us have some sort of disc herniation going on and we're asymptomatic. I'm talking about people who went through a very traumatic experience, such as a bad car crash or a fall from the top of a building or something like that. That's what I'm talking about here. They'll have a severe compression of their nerve, which leads to the nerve, parts of the nerve start to decay, and then the limb starts to atrophy because it doesn't have that input going on. And then there's also bowel and bladder dysfunctions. Again, this is more rare than not. This is typically certain parts of the spinal cord have to be involved. But if you do have bowel and bladder dysfunction, that could also be the cause of it. So, you see how, and again, going back to like the persistent weakness part of it, you might experience some weaknesses, but a lot of times too, weaknesses can come from compensations. They can come from the fact that you don't really want to put so much effort into that limb, so you start to use the other side more and that side less. That can also be the cause of this. It's not the fact, when I'm talking about weakness, I'm talking about, just like I said with the atrophy, that the nerve is almost like cut off and it slowly starts to lose its resiliency and robustness, and it starts by the numbness, but then eventually the muscles start to, you start to lose that firing of the muscles, and eventually, the muscle itself starts to atrophy. So this is really what is nerve pain, if we're really talking about it. Also, you can call this a neuropathy too. So this is where we're going to dive a little bit more into, what is going on. So what we're really talking about is a neuropathy. A neuropathy is like a pathology of the nerve, or a radiculopathy, which is a pathology of the nerve root, or where the nerve comes out of the spine. And these are temporary. This is not something that goes on. And again, even like radiculopathies and neuropathies, there's a good chance it's not necessarily that. And realize that these are kind of like garbage terms too. And I say this in the same way that I talk about sciatica. I absolutely, for the love of all things holy, cannot stand when someone says sciatica. Because sciatica does not mean anything. Sciatica means that you are having some abnormality of the sciatic nerve. That's it. That's all it means. Or, radiculopathy is basically you're having some dysfunction of the root of the nerve, or, some neuropathy. Now, there are so many things that are happening. You got to realize that the nerves go from the brain, they go down, they go down the spinal cord, then they go out of the spine, they go past a lot of structures there. They go through, above, below, muscles, all the way off to grandma's house they go. Like, there is a lot of soft tissue that they come in contact with, so there's a lot of things that can happen. Many things that can go wrong, if you will. But again, that doesn't mean that it's that serious. People, again, they get scared and they think, oh, I'm having nerve pain, like something's blocked off, I got a herniation, I have a bone spur, I have something that's causing this. Not always the case. So what is it then? Well, for one thing, it's a mobility issue. Now, no, mobility comes in all shapes and forms when it comes to this. Mobility can be that your body is not moving the way it should. Mobility could even mobility is your muscles. Like if your muscle is not moving the way it should, not firing, not activated appropriately, you're not going through full ranges of motion, and your muscle doesn't have that, and soft tissue doesn't have that elasticity, that can be the cause of it. But also we're talking about mobility, let's back up a little bit, joints aren't moving like they should, but we're also talking about nerve mobility. So your nerve needs to do what's called gliding. And so whenever you're doing a certain movement, realize that the nerve moves. The nerve doesn't just stay still. So when you do things such as like bring your knee up towards your nose, you're putting your nerve at kind of a stretch, because you got to realize, again, there's a lot of things that's flowing through, so you kind of put it through a stretch. But then when you put your foot back down, now you take it away from that stretch. Well, if your nerve can't move, can't glide appropriately as you do that stuff, you're going to get a little tension on that nerve, and it doesn't like that. So realize that mobility can be an issue. Deconditioning is another issue. So I use deconditioning in a lot of different ways here. So for one, if your strength and your overall functional capacity for life is not there, then certain aspects of your body are going to take the brunt of that force. But when I say deconditioning too, I also mean deconditioning to actually adapt to the activity that you're doing. So you have to, looking at this, so like from a deconditioning standpoint. So we've talked about this before, but there's two terms called sensitization and desensitization. So sensitization is basically, does your nerve adapt? Or, excuse me, is your nerve like super sensitive to a certain stimulus? So for instance, if you are just starting to go to, like, let's say you're just starting to go to the gym, and you're just starting to go to the gym, and you feel that excessive soreness after the first couple of days because your body is not used to that. You are sensitized to that stimulus of working out. But what happens after a while is you desensitize to that. So your body gets used to it, and so you're no longer as sore as you typically are. Okay? This is what happens also with our system. If our system is not conditioned well enough to adapt and overcome the stimulus, it's hypersensitive. But once it does become adapted to it, it gets better. So typically what I talk about with people that I'm working with is whenever we're doing a certain movement and we're trying to get them past a certain tenderness, you actually want your muscle, you want your body to experience some of the symptoms that you're going through. Because then your brain realizes, after it's exposed to enough, your brain realizes, oh, this is kind of normal. And then it desensitizes to that. And now what used to be a 8 out of 10 pain that it was used to, now it's more like a 5 out of 10 pain, and so on and so forth. Now, there's obviously a happy medium here. You don't want to just like constantly keep beating at your body and putting it through like an 8 out of 10, but you eventually want to, again, progress it in a meaningful and appropriate way. Change in activity. This is a huge one. If you are doing a certain activity more, that, again, your body is not used to that. You might mentally not be used to that. So at first, there's going to be a little hypersensitivity. But then after a while, it gets better. But at the same time with change in activity, let's say you are like, you're going on a week-long, National Lampoon's Vacation type of trip to where you're sitting in your car for long periods. Well, because you're sitting for long periods, the front aspect of your body is going to be a little bit more tied down, whereas the back of your body is going to be a little bit more stretched out. Well, this is where you see people, they pull to a rest stop and they get out and they're kind of hobbling for the first couple steps. Well, if you're doing this days and weeks and months upon end, then you're going to see a change in that overall mobility, that overall elasticity of the body. And so, again, this is where understanding and realizing that you changed the activity, and no, it's not the end of the world. It's going to get better, trust me. This is also the same with, if you know that this change is coming, you can prepare for it. So, for instance, if you know you're going to do these long rides, plan to make lots of frequent stops so that you don't sit for long periods of time. You aren't in that position that you're used to for long periods of time. I'm typically on my feet a lot throughout the day. When I have to sit for long periods, I hate it. My body gets pissed off about it. And so just realize and look back at what changed the activities. Something else too, with neck and elbow pain that comes into play. What surface are you sitting in? Because what happens is when people get new chairs, they don't think about it. And when your elbow rests in a certain position on an armrest in a chair, you can actually cut off the nerve a little bit, and that's why you experience that numbness in your hand. Same thing when you sleep at night. When people lay on their sides, their wrist will rotate a little bit, and their elbow will rotate to where they actually put that little gap, like your funny bone, will rest on the mattress, and it'll actually close down the nerve. This is what happens when people sleep on their side for long periods and they wake up and their hand is numb. It's not actually, again, neuropathy, radiculopathy. It's just a garbage term in the sense it's very general. Just because you have that doesn't mean that there's a structure that's wrong. It means that you just put force on it at a certain time for a certain amount of time, and that's why things went numb. Same thing happens when people sit on a commode. This one's always funny to me. If you sit on a commode for long periods of time, you are placing a lot of pressure on your sciatic nerve on both butt cheeks, because that's where your sciatic nerve comes down through, is by your butt cheeks. So when you're sitting in those periods for a long period of time, you're actually closing off the sciatic nerve for a little bit, and so that's why when you get up to try to walk, your feet are numb. Now, hope to God you've never been on the pot for that long, but if you have been, that's why. That's why your feet go numb. It's not anything wrong with you. Realize, too, that also stretch can do this. So, again, talking about the commode example, when you're sitting and your knees are up, you are putting the back, like your hamstrings, your butt, all that stuff at a stretch, and stretch actually puts a little extra strain on the nerve. But the nerve is also being stretched too, so there's that little extra strain there. So a prolonged stretch can actually cause some problems here, so just realizing that. Inflammation is another thing that can really cause some unhappiness of your nerves at the time. So, and realize too that all of the stuff I'm talking about also affects the muscles and joints and soft tissue. So they are also being affected, and that's where your discomfort's coming from. Your discomfort's not just coming from the nerve. It's coming from the discomfort of all the other structures too. That's why I say this isn't nerve pain. This is, a regional discomfort that's going on. So inflammation, for instance, if you have swelling in a joint, if you have swelling in a muscle, if you have swelling in a limb, what that does is you got to realize there's a very finite amount of space going on there, because otherwise we would just be big blobs running around. So you have a very finite amount of space to work with. If you inject fluid into those areas, now you've compressed that space and you've compressed the tissues in there, and the muscles, nerves, arteries, and veins are going to be one of those things, and so that's why you're going to experience that discomfort the way that you do. This happens a lot after surgeries. This will happen, whenever we're sick. If we have the flu or things like that, there's a big systemic change and inflammation happens. And yeah, so, realize that inflammation can cause this too. And things like, if it's a hotter day out and you've taken up you've taken in like some extra salt or something like that, and you feel your limbs kind of swell up. Things like that can contribute to it a little bit too. Also, something to realize that with inflammation, isn't really inflammation, but when you sleep at night, all your fluid, or whenever you're functioning throughout the day, all your fluid is dispensed all throughout your body. When you sleep at night, your joints, your discs, all that stuff, they reabsorb that fluid that's floating around. And so, again, it kind of shrinks those spaces. So that's why a lot of times when you wake up in the morning, you're a little bit stiff until that fluid starts to be pumped around again. So, again, inflammation can be a big cause of this. Medication. If you had a change in medications can sometimes cause some type of nerve pain, or they can cause some type of inflammation, or they can cause an increased sensitivity or hormonal changes, and this can be what can also contribute to that. So this is a quick one. Any medication changes, just realize that. Last but not least, a huge one is recovery. If you are not recovered enough, and I'm not just talking about from an exercise standpoint, if you're not sleeping well, if you're not eating well, if you're not providing the R&R that you need, and you're not recovered, what happens is your body is ignited because it's not recovered. We need to be in a rest digest state like a parasympathetic state for our body to recover. If we are in a fight or flight hypersensitive state, then we're not going to be recovered. And then what happens is our body becomes a lot more ultra sensitive. I've known people before, patients who they come to me one day and they might have like a 2 out of 10 pain, and then they come to me 2 days later after getting hardly any sleep, and it's actually been up to a 6 out of 10. Nothing is any worse, but their sensitivity, that sensitization like we talked about earlier, is heightened, and so they're going to be a little bit more sensitive to any type of stimuli. So just keep that in mind too. So, all right. So how do you self-assess, first off? So, for one, can you put yourself in a position of discomfort versus relief? If you're experiencing some sort of like nerve pain or some sort of pain, and it doesn't matter what type of position you get in, it just does not make it any better, then something is going on. Now, if you just had surgery or there was an injury or something like that, sure. Or if you have the flu, that's a little different story. But if you're healthy and you experience some like discomfort in your low back, in your hip, or anything, in your shoulder, and changing position doesn't make it any better, there's something wrong, and that's when you need to go to someone to help you. Something for the upper body is called Sperling's test and shoulder abduction test. So Sperling test is basically, let's say you have a little bit of pain on your left side, and you bring your left ear down to your left shoulder, and then you can have somebody else kind of just push down on your head just a little bit, not too much. If that makes symptoms worse, then there might be a little bit of infliction of some sort of pressure on the nerve of your upper extremities, your arms, for instance. But if there isn't any, then you're good. Something else you can also tilt your ear to that shoulder. So if it's your left side that's bothering you, tilt your ear to that shoulder, and you bring your hand up and put it on top of your head. If that makes it feel better, then there might be some little compression going on within like the nerve root of the spine. But again, if you do that and it doesn't feel any, and it feels the same, then it might be something else. So another for the low back is what's called a straight leg raise test. So basically you lay flat, you lift your leg up. If there is no increased pain or discomfort, then you're good. If you lift up the other side and the same thing, you're good. Now realize that you can lift up the left side to look at the right side of your back, and you can lift up your right side to look at the left side of your back, but then you can also left side look at left side, right side look at right side. So, and then the slump test, basically you sit at the edge of the bed, you like put yourself in the worst posture ever, bring your chin to your chest, and then straighten your leg out. If you feel a lot of tension with that, then there might be something going on as far as like nerve compression in the back. But if that doesn't change anything, then you're good. Now realize that with these, when you first wake up in the morning, again, there's more fluid in your spine, so you're going to be hypersensitive to these. So don't do these right off the bat in the morning. Walk around a little bit, get the blood moving, maybe wait till late morning to assess this before you get a true assessment out of it. All right, coming down to the wire here. So, as you know, we always end these episodes with 3 actionable items. Well, today, I'm going to give you 3 not to-dos when you have stuff like this. So, without further ado, number 1, if you think you're having some sort of nerve problem, which typically it's not, again, it's probably contributing to the muscles, the soft tissues, and the joint that also surrounds it. For one, do not panic. This is where things go out of whack, is people start to panic. People think that there's something wrong. They think that they're dying. They think that there's a tear, there's a herniation, there's a nerve impingement, they're having some sort of systemic fight back, whatever. Do not panic, because more than likely it's nothing. More than likely it's just it's, again, just like a little compression thing going on there. Or it's just some sort of little change that happened. Again, whether you started something new, you did something different, you took a medication, you ate something you shouldn't have, you didn't sleep well, you may experience an injury, but again, don't panic. Number 2, do not get an MRI. This is what people typically do. They think they're feeling something and they get an MRI, and then the MRI is probably going to show something going on there because life, and we're old, and as we get older, we start to develop certain wrinkles and certain protrusions, stuff like that. It's all normal. It doesn't mean that's what's causing it. Again, you get an MRI, you learn what's actually going on in your body, and then boom, you start to panic, and then we're going back through the cycle. As I've mentioned before, studies show that people 55 and older, over 70% of those people, if you do an MRI, who are asymptomatic, meaning they don't have any pain, they haven't had pain, if you do an MRI of them, you'll find something. So do not get an MRI without trying some sort of holistic approach first, which leads to the last one is, do go to a specialist after 6 weeks. Give it 6 weeks. If it gets better, cool. You can go to a physical therapist, you can go to a chiropractor, you can go to some sort of, I'd watch with specialists such as surgeons, because again, they might want to give you a medication, they might want to convince you of surgery, but more holistic approach like a chiropractor or PT, you can go to them first, but really don't take any big steps until about 6 weeks. After 6 weeks, within 6 weeks, natural healing will occur, and whatever may have went out of whack will go back to normal. If after 6 weeks it doesn't go back to normal, then it might be time to have somebody else take a look at it. All right. I hope I didn't bore you guys too much with that, but again, all things nerve pain and actually what's not nerve pain related. Again, this is to keep you from going off the handles and panicking too much about this, and realize that more often than not, it's typically just a little change that happened, might have a little bit of swelling, might have a little bit of tightness, might have some inactivity or deconditioning. For the love of God, just move. Move. Get that blood flowing, get that mobility up, burn some calories, make sure your weight is in a nice and healthy range, and figure out ways to be happy and joyous. Till then, everybody, love you. Have a great week. Mwah.